Hi, Lorraine.
Hi. How are you?
Great. So great to have you back.
Thank you.
Yeah.
I'm excited to be here.
I'm excited. So could you verify your date of birth for me, please?
August 3rd, 01.
Okay. Excellent. So I know you're here for a head to toe exam, but do you have any particular issues that you want to focus on today, or anything that's been bothering you?
Yeah, I have a really bad itch.
Okay. Where is it?
It's like right here, just like in a random spot right here.
Okay.
Kind of
It's right on the
rashy
edge.
and itchy, flares up when I wear certain clothes.
Ooh, okay. So it's rashy, itchy. Well, let me take a look at it real quick.
Yeah, just right here.
Okay. Yeah, I'm definitely going to do an inspection of that later. I'm seeing some redness and some bumps too.
Kind of flaky.
Have you been scratching it a lot?
Every day.
Yeah, I'm sure it's hard not to. Ooh, okay. Do you know anything that could have caused it? Like using new detergent, or maybe you were outside in nature, just wearing a sports bra, brush up against some leaves? Or...
I remember gardening like a few weeks ago.
Okay.
So I was gardening, and I remember like I had a bug bite here.
Oh, it could be a bug bite.
Could be something like that.
Definitely. It is that season. We're definitely out there.
Yeah, super itchy.
So I'm gonna measure it. I'm gonna see if I can apply any kind of topical treatment and make sure that it's not any kind of deep tissue kind of reaction. So yeah, aside from that, anything else?
No, I have like some lower back pain. Nothing out of the ordinary, but definitely something that's consistent.
Sure. Do you believe that it's occupational? Is it from holding a position at work, or?
Probably. I sit a lot at work.
Yes. So we tend to lean forward a lot,
Yeah.
you know, when we're looking at the screen a lot for our jobs.
Right.
So I can take a look at that as well. Cool. I'm just going to go over some brief family history. Do you have any family history of diabetes?
Yes. On my mom's side.
Mom's side.
Yeah.
And do you know what type?
I think it's type 2 diabetes.
Okay. High blood pressure?
Yes.
Okay.
Yeah, on both sides.
Both sides. Okay, we'll definitely measure that. Thyroid issues?
I hope not. No, I don't think so.
Okay, all right. No known thyroid issues. Muscular disorders?
No muscular disorders.
Okay. Lung disorders?
No lung disorders.
Okay.
I don't think so.
Great. Any neurological problems?
Yeah, my grandpa was schizophrenic.
Okay.
But he's dead, so
Okay.
sorry. Just
Yeah. No, it's
details.
It's really good to know this. But no signs exhibited in your immediate family?
My mom's a little schizophrenic.
Okay. All right.
It's just like here and there.
Okay. And no symptoms with yourself or siblings?
Not yet.
Okay. All right. Okay. Well, I definitely can refer you to a psychiatrist if you're interested in having a talk or assessment with someone about that. But yeah, definitely. Okay, so if that is all, I'm going to take your vitals. Then we're going to just get you comfortable laying down on the bed. I'm going to do an in-depth examination of your eyes and ears, cranial nerve exam, and scalp. Then we'll go ahead and look at that, the itch as well. Okay? Any questions?
No, I think I'm okay.
Okay, great. Okay. Okay. I'm going to start by listening to your heart and your lungs. Okay. Okay. Just going to move your hair out of the way. Perfect. Okay. All Heart rate sounds normal. I'm going to flip it over and listen to the bell side for murmurs. Okay, no S3 present, only S1 and S2. I'm not hearing any arrhythmia. Okay, great. I'm just going to listen to your lungs now. You can just breathe normally. Okay. Make sure your legs are uncrossed. Don't cross your ankles, okay? Okay. Okay, great. And no issues with racing heart or abnormal breathing?
No.
Okay.
I'm good.
All right. Okay. I'm going to take your blood pressure. Okay. Okay. Okay, your blood pressure is normal, so I'm just going to go ahead and see if I can slide this off. All right, can I see your index finger? Let's just hold it right there for me. Let me take your temperature. That's great, that's 90, 96, so you're fine. Your heart rate is 83 beats per minute. Oxygenation is 98% at room air, so all great values.
Perfect.
Yeah. Okay. Okay, I'm just going to do an initial inspection of your face before you lay down, okay? So I'm just going to palpate the face with my hand. Just looking for any signs of edema, abnormal temperature, feeling your lymph nodes, your preauricular and postauricular lymph nodes. Okay. Non-palpable, so that's good. Okay. Just going to feel the back of your head for any signs of a concussion. Okay, I'm just going to feel along the thyroid. Normal. Okay, going to do some percussions. You're just going to feel a light tapping. Okay. Okay, everything seems good so far. We're going to do a quick warm or cold test. Okay, so let's see. So this tongue depressor, that's going to be a warm sensation, and then this will be cold. Go ahead and say warm or cold. Okay, and close your eyes.
Cold. Warm.
Okay.
Cold.
Good.
Warm. Cold. 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 Warm. Warm. Cold. Cold. Warm. Cold. Warm. Cold. 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 It made me jump.
Sorry, I didn't mean to startle you. So you got a few of those wrong, most of them right. I'm not too concerned at this point. So I'm going to have you lay down in the bed so I can continue the cranial nerve exam just from a laying position to get you more comfortable.
Okay, thanks.
So first I'm going to be doing an initial inspection of the skin. Okay, so you don't have to do anything, just close your eyes. Okay. Okay. Skin is very healthy. I'm not seeing any abnormal discoloration. Don't see any sun damage at all. Do you use SPF?
Every day.
Okay, good. Good. I can definitely tell. It's very well cared for. Yes. Okay. Okay, I'm just going to take a little bit of a closer look with a magnifying light. See normal moisture. Okay. Okay. I'm going to place my fingers directly on the bridge of your nose. Okay, these are called myotome tests. Try to move your head to your left and resist my push. 3, 2, 1. Good. Let's do the opposite way. 3, 2, 1. Very good. Okay, same thing. I'm just placing my hand on your cheek. 3, 2, 1. Good. Now the opposite way. 3, 2, 1. Okay. Try to look up at the ceiling for me. Resist my push, or look up behind you.
Behind me?
Yes, try to turn your head up.
Got it. Okay. Sure.
That was good enough. I think I
Should count down?
All right, let's count down.
Okay, let's try.
Try to look up, stretch your neck out. 3, 2, 1. Good. Very strong.
Thank you.
Now you can touch your chin to your chest in 3, 2, 1. Okay. I'm going to be pulling gently on your ears. Let me know if you feel any pain. Pain or no? Okay. Let me know which direction I'm pulling. So pulling up, say up, down, say down, and back, say back, front, say front. Okay.
Okay. Down.
Good.
Up.
Good. Okay. So that's good so far. I'm going to do a color assessment test, okay? So look ahead and tell me, or look at this pencil here. Tell me what color it is.
Yellow.
Good.
Orange.
Good.
Brown.
Good.
Green.
Yes.
Pink.
Red. Yes,
Pinky red.
you displayed a lot of distress when looking at that pencil. Did anything come to mind in particular, or you just were stressed about getting it right?
I'm scared.
I would be scared. It's a medical exam. Everything so far is going really well. Really well.
Okay.
You're smashing it.
I'm smashing it. Okay.
Yeah, you are.
Thank you.
Okay. What about this color?
Pink.
Great. Okay. Okay, go ahead and just place your head gently this way. Close your eyes. Okay. Let me know if this is a wet or a dry sensation. Okay, so this is dry and this is wet. Did you feel the difference?
Yes.
Great. So go ahead and say wet or dry.
Dry. Wet. Wet. Dry. Dry.
Good.
Dry. Wet.
Sorry.
Wet. Dry. Wet. Wet. Dry. Wet. Wet. Wet.
Okay. All right. Next, we're going to do cold or dry. Okay.
Cold or dry?
Yes, cold or dry.
Okay, dry. Cold. Cold. Dry. Cold. Cold. Dry. Cold. Cold. Dry. Dry. Cold. Cold. Dry.
Good.
Cold. Cold. Dry. Cold. Cold. Dry. Cold. Cold.
Very good. Next, I'm going to take a look at your eyes.
Okay.
Okay. Any problems with your vision? Seeing double, blurry vision?
No.
No? Okay, great. When's the last time you had an eye exam?
Maybe 8 months ago.
Okay, and everything seemed normal?
Yeah, everything seemed normal for the most part.
Do you wear contacts?
Yeah.
I see them in right now.
Yeah.
Are you happy with your prescription?
I feel like I'm overdue for a new one.
Yeah?
Yeah.
And your optometrist didn't really address that during your eye exam or?
No, she did, and she changed my prescription, but I don't know. I think it's gotten worse since then.
Since then? Okay, well, we can definitely book you for an in-depth eye exam here at the clinic. I know a really good doctor.
Okay.
Her name's Dr. Katie, and she can totally go over
I think I met her.
Yeah. Oh, great. Okay, well, we can definitely talk about that later. But for now, I just want to assess your eye health overall.
Okay.
So pick a point at the wall to look at. Sorry about the bright light. Totally fine. Open your eyes all the way. Okay. Perfect. Okay. Not seeing any yellow or excess drainage, no excess moisture, no sign of infection. Go ahead, look to your left, look to your right, look up, look down. Okay, look straight ahead. Good. Your pupils are round and reactive. Look at the other one. Okay, say the same thing. Look up, look down, to your left, to your right. Okay, now roll your eyes. Okay, any difficulty doing that?
I don't know how to do it well.
I think you did it very well.
Thank you. Oh my goodness.
I'm not seeing any issues here. Okay, so that's good. Okay, so go ahead and pick a point on that wall, okay? Let me know when my fingers enter your field of vision. Say now.
Now.
Okay, and look at me. Which fingers are further away, the ones on your left or your right?
Left.
Okay, and what about now?
Right.
No peeking.
Sorry.
Look right at me. Left or right?
Left.
Good. Left or right?
Right.
Good. Okay. Okay, now I want you to follow this light, okay?
Okay.
Okay, good. Now follow my fingers and ignore the light.
Okay.
That's a lot. You're doing really well. Keep going. Fantastic. Okay, now let's go ahead and just do a preliminary check of your vision. I know you said that you're wanting a stronger prescription. So if you could go ahead and read this row for me, starting with the D.
D H J B S.
Good. Now go ahead and read this row beginning with the C.
C F D H J.
Okay, I'm going to bring it a little bit closer. Read that same row beginning with the C.
C F D H J.
Great. I'm going to bring it farther away. Can you still read it? Okay. Can you read the row beneath it, the last row?
L T F P H.
Perfect. And read it backwards. I'm going to bring it a little bit further away.
H P F T L.
Awesome. What color is this?
Orange.
Good. What color is this?
Green.
Great. Okay. And is number 9, is this circle smaller or larger than number 6?
Larger.
Okay. Is number 5 smaller or larger than number 2?
Larger.
Is number 2 smaller or larger than number 7?
Smaller.
Great. Okay. All right. Next, we're going to do a sharp or dull test. I think that I've done this with you on a previous appointment, but let me go over it. So this is a dull sensation.
Okay.
This is sharp.
Okay.
So close your eyes and say sharp or dull depending on which one you feel.
Okay. Dull. Good. Sharp. Dull. Sharp.
Good.
Sharp. Sharp. Dull. 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 Dull.
Good.
Sharp. Good. Sharp.
Mm-hmm.
Dull.
Good.
Dull. Sharp. Sharp.
Yes.
Dull.
Yes.
Sharp.
Good.
Dull. Dull.
Good.
Dull. Dull.
Yes.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Excellent. Okay. All right, I'm going to take a look inside your ears next. So go ahead and turn your head this way. Just going to look inside here. Okay. I don't see any signs of infection or irritation, but you do have a lot of wax buildup. Do you mind if I clean that out a little bit today?
No.
Okay, great. Let me go ahead and look at the other ear. Okay. Same thing here. Just a lot of wax, but everything else looks healthy. As far as I can see, I don't see any scratching or signs of damage. So that's good. Okay. I'm going to start with just a little bit of cleansing solution. Just to sterilize the area. Okay. Just cleaning the outer auricle here. Good. I'm going to just start with some foaming cleanser. Okay, and this shouldn't hurt. Let me know if it does. Okay, definitely getting some of that debris out here. Okay. Just gonna pull it out with some solution here. this point? Alright, just kind of follow that with some solution here. Might tingle a little bit. Okay. I'm just going to gently apply some pressure here. Just seeing some tiny little signs of inflammation. Okay. Alright, that's looking a lot better. Okay, do you feel like you can hear a little bit better out of that? Okay, good. Now go ahead and turn your face this way. I'm just going to didn't have as much in this one, but still going to just... Okay, so first applying a little bit of the cleansing solution. It's going to feel a little cold here. Okay. Okay, just getting the outer edges clean, and now going to apply a little bit of solution here. And just one more of the foaming solution. Just getting back here as well. Okay. Just a little bit of pressure here. I'm just going to apply it. Okay, just to drain some of the sinus cavities. Okay, looks pretty clean to me. Go ahead and you can go ahead and face up now. All right. So now that your ears are a little bit more clean, we're going to do a hearing test. Okay. So go ahead and close your eyes first. I want you to let me know which ear that you hear the rustling sound on, your left or your right. You're going to hear my gloves do a little sound.
Right. Left.
Good.
Right. Left. Right.
Good. I'm going to whisper something in your ear. Repeat exactly what you hear after me.
Okay.
Halloween.
Halloween.
Pumpkins.
Pumpkins.
Squash.
Squash.
Decorative chords.
Decorative chords.
Good. Tomato soup.
Tomato soup.
Nutmeg.
Nutmeg.
Cinnamon.
Cinnamon.
Pumpkin picking.
Pumpkin picking.
Jack-o'-lantern.
Jack-o'-lantern.
Orchid.
Orchid.
Pine cone.
Pine cone.
Lipstick.
Lipstick.
Tote bag.
Tote bag.
Epic novel.
Epic novel.
Ireland.
Ireland.
Sunscreen.
Sunscreen.
Good. Fantastic. We're going to do a hearing test with a couple of tuning forks. Okay? So let me know which sound is louder.
Okay.
I'm going to give you two options, option A or option B. Okay? This is A. This is B. Would you like to do it? Okay. All right. Did they sound similar to you, or?
No.
Okay, you just seemed a little bit distressed with it.
I'm so confused.
Okay.
Play it again.
All right. Yeah,
Okay.
we're gonna do it again.
Okay.
Don't worry about it. You know.
Okay.
It's just a medical test. If you get it wrong, no.
Do you want my eyes open or closed?
Please keep them closed for this section,
Okay.
just so you can't see me moving my hand away back and forth. Okay.
Okay.
Is that okay?
Fine, that's fine.
Okay.
All right.
So we're gonna do it again. Which one is louder, A or B?
Okay.
Pretty simple test.
Okay.
A or B?
B. Let's go with B.
It's B. Yeah, you got it right.
Okay.
Great job. Well, we'll do one more. I don't want to cause you distress.
Okay.
A. B.
Okay. A was louder.
A was louder. A was definitely louder. Good job. Good job. Okay. Things are going very well. So now I'm going to be taking a tuning fork that vibrates. I'm going to be placing it on your head, sides of your face. Let me know when the vibration stops. You should be able to hear it and feel it at the same time.
Okay.
If you can only hear it or only feel it, let me know that too. But for now, just say no whenever it stops.
Okay. Now. 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 Now.
Okay, great. We're going to do one more tuning fork. Same thing, just a different frequency. Okay. I might be placing it on your sternum as well, just so you can feel that vibration.
Okay.
Beautiful. So you passed your hearing test with flying colors. Any difficulties hearing or hearing things that aren't there?
No, I felt good.
Okay, great. Next we have a fun smell and taste test. Okay. So close your eyes. I'm going to give you some things to smell. They're very distinct flavors. That should be pretty easy. Okay? So this first one, go ahead and inhale. What does that smell like to you?
Eucalyptus.
No.
Oh.
It was peppermint.
Oh. Same difference.
I think it was close enough. They both have a menthol forward flavor. So go ahead and inhale. What does it smell like?
Like lemon.
Okay, yeah, it's a citrus fruit. It was orange.
Okay.
But pretty close, pretty close. Okay, go ahead and inhale. What does that smell like to you?
Lavender.
It was rose.
Okay.
But at least it was a floral. It was a plant, so not too far off, just a little bit. Okay. This next one, go ahead and inhale.
It smells like a tree.
A tree? No, not even close.
Oh.
Vanilla.
Vanilla tree.
There's no such thing.
Okay.
Not to my knowledge.
I think my nose needs to be clean.
Oh, I'm definitely going to make some notes about that.
Okay.
Your nose definitely has an issue.
Good idea.
Okay. Go ahead and inhale this.
Okay.
Not something you like or no?
No, it smells like, that smells like lemon to me. Lemon.
Okay, good. So that was grapefruit.
Okay,
So that was
okay.
cool. I'll take it. I'll take that and run.
All right.
Okay, just a couple more. These are a lot. I really don't have high hopes for these next ones because they're a lot more subtle. Okay?
Okay, let's see.
Go ahead and inhale. What does that smell like?
It smells like unscented lotion.
Okay, lavender.
Oh.
I think that was close enough.
Okay. Could be.
This is another very distinct herb. I don't even know why I'm doing these ones because you failed the very simple ones.
Well, don't lose hope. Is it in my nose?
Is it in your... Go ahead and inhale.
It smells like nothing.
Okay.
Unscented.
That was basil.
Basil.
Okay. I'm just going to end the test now and we're going to say, we're going to call it and say that you need to see an ENT.
Feel.
Okay. Yeah, you failed that test. But there's some hope.
Okay.
I do have a couple strips for you to taste. Perhaps you'll get those right.
Okay, good.
Nose. Okay.
Okay.
So, go ahead and open your mouth. Close. Open. What did that taste like to you?
Tasted like nail polish remover.
Okay. That was control paper. It shouldn't have tasted like anything. So you tasted a very strong acetone. Okay. Well, here we are. Let's do one more. Go ahead, open your mouth. Close. Open. Okay, what did that taste like to you?
It tasted like paper as well.
Okay.
What was it?
It was cinnamon.
Okay.
So definitely a cranial nerve issue relating to your taste and smell. Do you ever smell or taste things that aren't there, like a metallic smell or smoke?
Sometimes.
In your mouth or nose or both?
Both.
Okay. Does this happen, do you think, daily?
Every day of my life.
Okay. Wow. I'm just going to take a couple notes on that too. Just going to write you a few referrals.
Good.
Just give me a second here. so next we're going to move on to just examining your scalp a little bit, okay? So stay seated where you are. I'm just going to bring out a lice comb and a couple tools.
Okay.
Okay. So I'm just going to be brushing through your hair real quick and just taking a look at the scalp.
Okay.
And just relax. Okay, you just turn your head slightly toward me. Perfect. Just take an initial inspection of the scalp. Looking for any signs of redness or scaly patches. So you said the itching is just limited to that midsection area, right? You don't have any itching in the scalp or?
No, not really.
Okay, good. I'm not seeing any signs of dandruff. I'm not seeing any irritation. I'm not seeing any chafing or flaking either. It looks pretty healthy to me. Okay. Okay. Going to do a quick sensory test with these brushes. Let me know if you feel the sensation once, twice, or 3 times as I brush on both sides of your scalp. So this is 1, this is 2, okay? It's gonna be 1 brush.
Okay.
This is 2, and then 3 would be this. Let me know if you feel once, twice, or 3 times, okay?
Okay. 2.
Good.
3. 1. 2.
Good.
1.
do see some white flakes here. Very mild dandruff. Nothing that requires treatment. And a couple red flakes. See some patches here. I'm just going to take a few measurements of moles. Don't have much mole. Just continue to relax. This is 3 millimeters and symmetric, flush with the skin, no issues that I see. Okay. Tiny little cherry angioma. Those are benign. 0.5 millimeter by 2, but flush with the skin, so not raised. Perfect. Okay, I'm just going to look through here. Sorry. Just gonna look here a little bit more. Any patches, any marks on the skin. Okay, I do see a freckle here. Okay. That is a little bit larger, 3 millimeters by 3. It's light brown in color. Okay. Okay, this one's light brown color as well. Okay, I'm just gonna write that down, but everything looks normal. I don't see any abnormally sized lumps. Okay. And real quick, we're going to do sharp and dull on the scalp. So this is sharp. This is dull. Say sharp or dull. Okay. Sharp. Okay. Dull. 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 Sharp. 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 Okay. Dull. Yes. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. That's great. All right, your scalp looks amazing. I'm gonna go ahead and do the abdominal examination next. Do you mind if I lift your shirt a little bit during that portion?
No.
Okay, great. Okay, Lily. So, with your permission, I'm just going to lift your shirt just a little bit so I can better visualize your abdomen.
Sure.
Okay. Okay, I do see that area you're talking about here. I'm just going to listen first, listen to your stomach, see what kind of sounds are emanating from there. Okay. Okay, you can just close your eyes, relax. Sorry, it's a little cold. It's okay. Okay, normal sounds. Okay, sounds are normal. Just gonna do some percussions. Okay. Okay. And next I'm going to palpate the abdomen, okay? You're going to feel a light pressure. You shouldn't feel any sharp stinging pain, but if you do, let me know that, okay?
Okay.
Any pain here?
A little bit.
Okay. A little bit of pain. Is it like a soreness or is it a sharp pain?
Just sore.
Okay, just a little bit sore. Okay. Okay. And what about on this side when I press? Is there pain?
No.
No pain. Okay.
Okay.
We're going to do cold or warm. Warm is going to be my finger. And you know cold. So go ahead and say cold or warm.
Okay. Cold. Warm. Warm. Cold. 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 Warm. Warm. Cold. Cold. Warm. 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 Cold. Cold. Cold.
Okay. Just going to be applying a little bit of ointment to your itch area. Okay. Okay. Is that painful? Does that sting?
No, feels
Okay,
good.
that's good. So this is a fast-acting foam that's going to really target the area from a antibacterial standpoint. It's kind of like Neosporin, only very, very strong, medical grade, fast-acting.
Okay.
It's also going to soothe the area.
Okay.
Okay. So I think you're good there. Just gonna put a little bit of liquid on there just to cleanse it. Just gonna rub that in here. All right, excellent. Okay, so I think that concludes our exam today, Elaine. I didn't see any major issues except for your smell and taste are a little off. I think that this wound is superficial. I just think you need to really not itch it for a while. The treatment that I applied today is going to help with that. But otherwise, you're doing really well. All your vitals came back normal. Blood pressure is great, so you don't have to worry about that.
Perfect.
And I will see you for follow-up in about 6 months.
Okay.
Okay. I'll also give you a referral to the optometrist and the ENT as well.
Perfect.
All right. But thank you for coming in. It was great to examine you today.
Yes, I love